when you need to see a health professional, you may envision going into an office or maybe even a hospital setting.
But our next guests are here to tell us about how they can come to you. So today's well-being is actually brought to you by Protein House.
And Ashley Murray and Leah Neugebauer, right?
Yep.
Did I do okay? All right, they're joining us from House Calls. Thanks for being here.
Now, you are both nurse practitioners. What is your role, and can you just explain what House Calls is? What is it all about?
Sure. So we are a company that started in 2019. We're actually a sister organization to Hospice of Red River Valley out of Fargo. So we are providing primary care into people's residence, their homes, if it's assisted living, if it's their own private home, apartments, nursing homes.
So this kind of like fills a niche of somebody either can't go to the doctor or the hospital or maybe doesn't want to. Like how does that all work? Who do they reach out to? Obviously House Calls, but how and what does it really look like, the process itself?
Yeah, so the process kind of starts with, adults living with chronic disease. So basically think of anyone kind of over the age of 40, right? They might have high blood pressure, high cholesterol, diabetes, those sorts of things. Well, it gets to be harder and harder to go out of their home as they age, to go to the clinic. They have to talk to their kids, get rides, things like that. So they can contact us and we can just bring the doctor's office to them. They're able to see us more often. It's much more convenient for them and it keeps them in their home.
And what can patients kind of expect at maybe that first visit, or when they have called House Calls and thought this is going to work for them? What can they expect at your first time visiting?
Sure, it's pretty much like a meet and greet. We go in there, we usually get records ahead of time, so we go in there and we get to know the patient. We get to see their living environment, get to know about their family, and what they need most from us. So we're just kind of like going to the clinic in the same sense. We can do different assessments, we can do lab draws, and manage their medication. I mean, our goal is to keep them independent at home.
Is there anything too small or anything too big, like a medical, what am I thinking of? Help me out, guys.
Like intervention? Or
Not really, actually. Ashley and I have been nurse practitioners in the Bismarck-Mandan area for going on 15 years now, so we know a lot of the other specialty providers in town. And even if it's maybe a diagnosis that's, quite complex, we know when to refer and bring in other specialists to help along the way. So really there's never anything too big, and there's obviously nothing too small, right? Our health is super important, so any little thing needs to be addressed, and we can do that.
Sure.
Who do you think might benefit most from considering House Calls? If they've never heard of you before or anything, who do you hope is listening right now who could benefit most?
Sure. I think it's the patients that, are relying on their, other family members to take them to the clinics, or, they just don't feel comfortable driving anymore. That's where we can really benefit, is we can come to them so we can keep control of their chronic conditions and hopefully prevent them from frequent admissions to the ER or even the hospital.
And who can make the appointment? Does it have to be the individual themselves? Is there a caretaker? How would that look?
Yeah, so it can be the patient themselves. A lot of times it's their kids. So say you've got, mom's living in assisted living, she's 80, she's not driving anymore. The kids are busy, it's hard to get off work to take them to the clinic. So their children, who are probably their power of attorney for healthcare or finance, can call and get that established as well.
Okay.
And what would you say you two enjoy about getting to go to people's homes? I mean, I think of almost like a different time in our world where, the doctor used to come to your house. House Calls, what do you enjoy about it?
Because we're not just considered a provider, we actually just become part of their life, I think. We get to know more on a personal level. They feel comfortable. I mean, there's times you go into a patient's house and they're like, would you like a cup of coffee? Would you like a cookie?
Yeah.
They share with us.
Yeah.
I love it. Anything else you want our viewers to know about House Calls?
Just that we serve patients in the Bismarck-Mandan community as well as surrounding areas. So if you think that this could be something that might work for you, don't hesitate to get in touch with us.
Sure. Perfect.
Ashley, Leah, thank you so much
Thanks,
for
ladies.
being with us.
Thank you.
Thank you.
And House Calls is located at 1400 43rd Avenue Northeast, Suite 212 in Bismarck. You can call one of the numbers or check out their website right there on your screen, carethatcomestoyou.org.
And this has been Wellbeing, brought to you by Protein House with